Listen, guys, pay attention to what I'm about to tell you. Watch this video. You can skip through it. There's two parts you need to watch. The first 5 minutes, and the last, and I think one through the middle, about 11 minutes. When you see words, it's very important that you watch what this man says. It's bullshit. It's lies, and they got big plans for us, guys. Big plans, bad ones. All right, much bigger scale than China, they say, and quarantine-wise. You understand? This ain't bullshit or propaganda. I'm telling you the truth, okay? Just listen to what I'm telling you. The first 5 minutes and the last 3, I think, okay? Just listen to what he's saying, because it's not 15. He contradicts himself 4 times, but it's 60. There's 60 confirmed by, and that's just what we know of. Love you guys. Enjoy the video. Please share this, okay? I'll see y'all later.
Asked me to recognize the Secretary of Health and Human Services, Alex A.U.R.A, and also the Deputy Director of CDC, Dr. A.U.R.A, for remarks. Secretary.
Well, thank you, Mr. Vice President, and thank you, Mr. President, for gathering your public health experts here today and for your strong leadership in keeping America safe. And I just want to say I could not be more delighted that you've asked the Vice President, my old friend and colleague, to lead this whole of government approach with us under the Emergency Support Function number 8. As of today, we have 15 cases of COVID-19 that have been detected in the United States, with only 1 new case detected in the last 2 weeks. We also have 3 cases among Americans repatriated from Wuhan and 42 cases among Americans repatriated who had been stuck on the Diamond Princess in Japan. The President's early and decisive actions, including travel restrictions, have succeeded in buying us incredibly valuable time. This has helped us contain the spread of the virus, handle the cases that we have, and prepare for the possibility that we will need to mitigate broader spread of infections within the United States. The President's actions, taken with the strong support of his scientific advisors, have proven to be appropriate, wise, and well calibrated to the situation. We're grateful for the hard work that healthcare workers, first responders, communities, and state and local leaders have put into the response so far. Because of this hard work and the President's leadership, the immediate risk to the American public has been and continues to be low. Our containment strategy has been working. At the same time, what every one of our experts and leaders have been saying for more than a month now remains true. The degree of risk has the potential to change quickly, and we can expect to see more cases in the United States. That is why we've been reminding the American public and our state, local, and private sector partners that they should be aware of what a broader response would look like. CDC has recommended that the American public, and especially state and local governments, businesses, and other organizations, should refresh themselves on how they would respond in the event that the situation worsens. We're encouraging Americans to learn what future steps might be necessary to keep themselves and their communities safe. Knowing these potential steps now can help keep the risk to you and your community low. Americans can find useful information at cdc.gov/COVID, COVID-19. And we're working closely with government and private sector partners to educate them about preparedness. Finally, we've begun working with Congress to secure the funding that we need. There are 5 major priorities in the White House request to Congress that the White House made on Monday. These priorities are: first, expanding our surveillance network; second, support for state and local governments work; third and fourth, development of therapeutics and vaccines; and fifth, manufacturing and purchase of personal protective equipment like gowns and masks. As chairman of the President's Coronavirus Task Force, I'm committed to providing regular updates from our coordinated interagency process. We've had our top public health leaders, like those joining me here today, speaking to the media many times per day to inform the American public. The Trump administration is going to continue to be aggressively transparent, keeping the American people and the media apprised of the situation and what everyone can do. With that, I'm going to hand things over to Dr. Ann Schuchat. Dr. Schuchat is the senior career official at the Centers for Disease Control and Prevention, the principal deputy director. with an over 30-year career at the CDC in public health and as a member of the United States Public Health Service Commission Corps. So, Dr. Schuchat, I'll turn it over to you.
Thanks so much, Mr. Secretary. As you know, this has been a difficult and challenging time, and our hearts go out to the individuals who have been directly affected by the virus and to all those who have been working tirelessly in responding to it. Our aggressive containment strategy here in the United States has been working and is responsible for the low levels of cases that we have so far. However, we do expect more cases, and this is a good time to prepare. As you heard, it's the perfect time for businesses, healthcare systems, universities, and schools to look at their pandemic preparedness plans, dust them off, and make sure that they're ready. And we have lots more information at the CDC's website and in partnership on how to do that. But it's also a really good time for the American public to prepare and for you to know what this means for you. The coronavirus that we're talking about is a respiratory virus. It's spread in a similar way to the common cold or to influenza. It's spread through coughs and sneezes. And so those everyday sensible measures that we tell people to do every year with the flu are important here. Covering your cough, staying home when you're sick, and washing your hands. Tried and true, not very exciting measures, but really important ways that you can prevent the spread of respiratory viruses. So the trajectory of what we're looking at over the weeks and months ahead is very uncertain, but many of the steps that we have taken over the past 15 years to prepare for pandemic influenza and our experience going through the 2009 H1N1 pandemic of influenza remind us of the kinds of steps that our healthcare system, our businesses, our communities and schools may need to take. We're in this together, all of government, the public and the private sector, and the CDC wants to make sure you have the best information available every day. Thank you.
I just want to give you a very quick update on the. My name is Dr. Tony Fauci. I'm the director of the National Institute of Allergy and Infectious Diseases at NIH. Just a very quick update on the countermeasure development in the form of vaccines and therapeutics. I had told this audience at a recent press briefing that we have a number of vaccine candidates and one prototype one to give you a feel for the time frame of a vaccine and what its impact might be now and in subsequent years, is that I told you we would have a vaccine that we would be putting into trials to see if it's safe and if it induces a response that you would predict would be protective in about 3 months. I think it's going to be a little bit less than that. It's probably going to be closer to 2 months. That would then take about 3 months to determine if it's safe and immunogenic, which gives us 6 months. Then you graduate from a trial, which is phase 1 of 45 people, to a trial that involves hundreds, if not low thousands of people to determine efficacy. At the earliest, an efficacy trial would take an additional 6 to 8 months. So although this is the fastest we have ever gone from a sequence of a virus to a trial, it still would not be any applicable to the epidemic unless we really wait about a year to a year and a half. Now, that means 2 things. One, the answer to containing is public health measures. We can't rely on a vaccine over the next several months to a year. However, if this virus, which we have every reason to believe it is quite conceivable that it will happen, will go beyond just a season and come back and recycle next year. If that's the case, we hope to have a vaccine. And then finally and briefly, therapeutics. There are a number of antiviral drugs that are being tested. A few days ago, we initiated a randomized controlled trial of a drug called remdesivir, which has antiviral activity in vitro in an animal model. The good news about that is that it's a trial that's randomized to either placebo or standard of care and drug and standard of care, which means that we will know reasonably soon whether it works. And if it does, we will then have an effective therapy to distribute. Thank you.
Thank you. Thank you very much, Mr. President. First of all, you have just come from a long and busy trip from India. And
Great country.
As far as this coronavirus is concerned, you have a great scientific and medical team behind you or with you, and I'm sure they will keep America safe. As far as your trip to India, Mr. President, where do we go from here as far as U.S.-India relations are concerned? And also, Mr. President, you are very famous in India, and Prime Minister Modi is very famous in America. What is the future? And Indian-American community is with you, Mr. President.
Yeah, we won't talk too much about that other than I just got back. Long flight. It's a long flight. He's a great gentleman, a great leader. It's an incredible country. We were treated very, very well, and we really enjoyed it. A lot of tremendous progress was made in terms of relationship. Our relationship with India is extraordinary right now, and we're going to be doing a lot of business with India. They're sending billions and billions of dollars now to the United States. But we'd rather talk about this right now.
The CDC said yesterday that they believe it's inevitable that the virus will spread in the United States, and it's not a question of if, but when. Do you agree with that assessment?
Well, I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level, or it could be at a larger level. Whatever happens, we're totally prepared. We have the best people in the world. You see that from the study. We have the best prepared people, the best people in the world. Congress is willing to give us much more than we're even asking for. That's nice for a change. But we are totally ready, willing, and able. It's a term that we use. It's ready, willing, and able. And we have. It's going to be very well under control. Now, it may get bigger. It may get a little bigger. It may not get bigger at all. We'll see what happens. But regardless of what happens, we're totally prepared. Please.
Mr. President, you talked a little earlier about the screening measures that you put in place and the travel restrictions you put in place regarding China. At this point, as the virus spreads in Italy and South Korea, are you planning on adding those countries?
Well, just so you understand, I'm the president of the United States. I'm not the president of other countries. Other countries, some are on the list that are very respected in what they do in terms of what we're talking about. But I really want to be responsible for this country if it means placing a very strong situation on the border so people can't come into our country from a country that is infected. We're doing that, and we've already done it with numerous countries. But we have to focus on this country. I don't think it's right to impose ourselves on others. But if others aren't taking care or we think they're doing it incorrectly, we're dealing with World Health. And we have terrific people. And CDC does go around and help other countries, give them recommendations as what to do. But they're working on their countries, and we're working on our countries. And so far, from our standpoint, it's really worked out very well.
Follow up on Steve's question. Can you clarify, are you considering restricting travel to and from South Korea, Italy, and other countries that have been affected?
At a right time, we may do that. Right now, it's not the right time, but at a right time. And we are checking people as they come through, specifically for the problem that we're dealing with. So we're checking a lot of people if they're coming from South Korea's been hit pretty hard. Italy's been hit pretty hard. China is obvious what's happened in China. But again, the numbers seem to be leveling off and going down in China, which is very good news. So we'll see what happens. Please.
The White House has spent today denying that they are going to appoint a czar to run point on the coronavirus response. Today, the Secretary A.U.R.A testified that he didn't think one was necessary and they were going to run it out of HHS. And you yourself have been downplaying this. So why are you now selecting the vice president to run
Well, Mike
point
is
on
not
this?
his vice president. He's in the administration. But I'm having everybody report to Mike. Mike's been very good, very adept. Anybody that knows anything about health care, they look at the Indiana model, and it's been a very great success. It's been a tremendous model in terms of health care, and this is really an offshoot of that. So this isn't a czar. I don't view Mike as a czar. Mike is part of the administration, but I'm having them report to Mike. Mike will report to me. They'll also be reporting in some cases to both. I'll be going to meetings quite a bit, depending on what they want to do and what message we want to get out. But we've done really an extraordinary job. When you look at a country this size, with so many people pouring in, we're the #1 in the world for people coming into a country by far. And we have a total of 15 cases, many of which, almost much within a day, I will tell you, most of whom are fully recovered. I think that's really a pretty impressive mark. Now, we did take in 40 people that were Americans, and they're also recovering, but we brought them in, so I call that, I have a different group. But we felt we had an obligation to American citizens outside of the country that were trying to get back in. We thought it was very important.
Mr. President, the stock market has taken a big hit over the past few days. What can you do about that? And if the CDC is right in saying that the spread is inevitable, are you going to be dealing with stock market issues and economy issues for some time to come?
Well, I really think the stock market is something I know a lot about. I think it took a hit maybe for two reasons. I think they look at the people that you watched debating last night and they say there's even a possibility that it can happen. I think 25,000 people to 69,000 people a year. That was shocking to me. And so far, if you look at what we have with the 15 economically, yeah, please.
Mr. President, have you been presented any plans that would involve quarantining cities like we saw in China, and what would have to happen for you to take a step
We do
like
have
that?
plans of a much on a much larger scale. Should we need that, we're working with states. We're working with virtually every state. And we do have plans on a larger scale if we need it. We don't think we're going to need it, but, you know, you always have to be prepared. And, again, Congress is talking to us about funding, and we're getting far more than what we asked for. And I guess the best thing to do is take it. We'll take it.
How much are you willing to give? How much money are you willing to give Congress if they're going $6 billion?
Well, we're going to
more
see,
than you
but we'll
offered?
take care of states because states are working very hard. We have hospitals in states that make rooms available, and they're building quarantine areas where you can keep people safely. We're working really well with states. It's a very big part of it. So, you know, my attitude if Congress wants to give us the money so easy, wasn't very easy for the wall, but we got that one done. If they want to give us the money, we'll take the money and we'll just do a good job with it. Yeah, please. Go ahead.
Mr. President, should Americans be going out getting protective equipment such as masks and so forth? And if so, what is the U.S. doing to boost production of masks?
Well, we can get a lot of it. In fact, we've ordered a lot of it just in case we need it. We may not need it. You understand that. But in case we're looking at worst case scenario, we're going to be set very quickly. But I don't think we're going to ever be anywhere near that. I really don't believe that we're going to be anywhere near that. Our borders are very controlled. Our flights in from certain areas that we're talking about are very controlled. I don't think we'll ever be anywhere near that. Please go ahead.
Back to the stock market for a second. The travel-related stocks have especially been hammered here in the last couple days. What would you say to Americans out there who right now are looking forward to the summer or the upcoming months and saying to themselves, should I make myself summer plan? Should I go travel abroad?
Well, hopefully they're going to be able to do that. We hope that it's going to be in good shape by that time. But, you know, they're going to have to remain a little bit flexible. Yeah, I would say travel-related companies, certainly right now, they would be hurt. At the same time, this ends. This is going to end. Hopefully it'll be sooner rather than later. And I think the business that they lost will be picked up at a later date. But, you know, right now, I think they're not going to be, probably not going to be going to China. They're not going to be going to certain countries where the problem is far greater than it is in the United States. What it's going to do is keep people home, and they're going to travel to places that we have. We have the greatest, it's the greatest tourism country in the world. So instead of leaving our country, leaving our shores, they'll stay here. And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
What is your response to Speaker Pelosi, who said earlier today that you don't know what you're talking about the coronavirus? I'm also wondering if you want to address critics who say you can't be trusted about what your administration is saying.
Sure. I think Speaker Pelosi's incompetent. She lost the Congress once. I think she's going to lose it again. She lifted my poll numbers up 10 points. I never thought that I would see that so quickly and so easily. I'm leading everybody. We're doing great. I don't want to do it that way. It's almost unfair if you think about it. But I think she's incompetent, and I think she's not thinking about the country. And instead of making a statement like that, where I've been beating her routinely at everything, instead of making a statement like that, she should be saying we have to work together because we have a big problem potentially, and maybe it's going to be a very little problem. I hope that it's going to be a very little problem, but we have to work together. Instead, she wants to do that same thing with crying Chuck Schumer. He goes out and he says, the president only asked for $2.5 billion. He should have $8.5 billion. This is the first time I've ever been told that we should take more. Usually it's we have to take less. And we should be working together. He shouldn't be making statements like that because it's so bad for the country. And Nancy Pelosi, I mean, she should go back to her district and clean it up because it's the #1. If you look at percentage down, that was one of the finest in the world, and now you look at what's happening. And I'm just saying, we should all be working together. She's trying to create a panic, and there's no reason to panic because we have done so good. These professionals behind me and over here and over there and back here and in some conference rooms, I just left a group of 45 people that are the most talented people in the world. Parts of the world are asking us in a very nice way, can they partake and help them? So Nancy Pelosi shouldn't, and she knows it's not true. She knows all they're trying to do is get a political advantage. This isn't about political advantage. We're all trying to do the right thing. They shouldn't be saying, this is terrible, President Trump isn't asking for enough money. How stupid a thing to say. If they want to give us more money, that's okay. We'll take more money. Some Republicans think we should have more money, too. That's okay. We'll take more money. But they shouldn't demean the people that are on the stage who are the finest in the world. They're not demeaning me. They're demeaning the greatest healthcare professionals in the world and people that do exactly what we're talking about.
Your campaign today sued the New York Times for an opinion piece.
Yeah.
Is it your opinion or is it your contention that if people have an opinion contrary to yours that they should be sued?
Well, when they get the opinion totally wrong, as the New York Times did, and frankly, they've got a lot wrong over the last number of years. So we'll see how let that work its way through the courts.
Right?
No, if you read it, you'll see it's beyond an opinion. That's not an opinion. That's something much more than an opinion. They did a bad thing, and there'll be more coming. There'll be more coming.
Tokyo will host a summer Olympics this July. Do you expect Tokyo will be?
I hope so, because Shinzo Abe is a very good friend of mine. I love the people of Japan, and I hope it's going to be in good shape. As you know, you have a number of people in Japan who have been infected. I hear they're doing a very professional job, which doesn't surprise me at all. With Shinzo and with all of the people you have, I know Japan very well. I think they're going to handle it very well. It's a little tight, you know, it's a little tight. They spent billions of dollars building one of the most beautiful venues I've ever seen. And your Prime Minister is very proud of it. I hope it's going to be fine. We hope it will.
Thank you very much, Mr. President. The doctor at CDC just talked about dusting off preparedness plans.
Right.
But coming from you, it has more weight. Do you feel that U.S. schools should be preparing for a coronavirus spreading?
I would think so, yes. I mean, I haven't spoken specifically about that with the various doctors, but I would think so, yes. I think every aspect of our society should be prepared. I don't think it's going to come to that, especially with the fact that we're going down, not up. We're going very substantially down, not up. But, yeah, I think schools should be preparing and, you know, get ready just in case. The words are just in case. We don't think we're going to be there. We don't think we're going to be anywhere close. And, again, if you look at some countries, they are coming down and starting to go in the other direction. This will end. This will end. You look at flu season, I said 26,000 people. I never heard of a number like that. 26,000 people going up to 69,000 people, doctor, you told me before. 69,000 people die every year from 26 to 69, every year from the flu. Now think of that. It's incredible. So far, the results of all of this that everybody's reading about, and part of the thing is you want to keep it the way it is. You don't want to see panic because there's no reason to be panicked about. But when I mentioned the flu, I said, actually, I asked the various doctors, I said, is this just like flu? Because people die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, we really have done a very good job. Go ahead.
Thank you, Mr. President. You mentioned the stock market earlier. To go back to that, to be clear, the Dow Jones dropped more than 2,000 points this week. Are you suggesting that that was overblown? Are financial markets overreacting here?
I think the financial markets are very upset when they look at the Democrat candidate standing on that stage making fools out of them.